keep asking ourselves, when will this pandemic be over? We know that SARS-CoV-2 is here to stay. It's endemic. But endemic does not mean harmless. It does not mean that SARS-CoV-2 is going to go away. For epidemiologists, endemic means that rates are static, not rising, not falling. Colds are endemic, but so are malaria and polio. In fact, smallpox was endemic before it was eradicated by vaccines. The vaccines that we routinely get are all against endemic diseases that could have severe complications. We must all make decisions to get vaccines to protect us from severe illness and hospitalization from a variety of diseases. This is particularly true with pregnant people who are more vulnerable to COVID-19. We have an expert with us to speak just on that topic.
My name is Dr. Stephen Morris. I'm an obstetrician-gynecologist here at Health Sciences North.
Pregnant people have an increased risk to severe COVID due to physiological and immunological changes that occur during pregnancy. Study after study has shown that vaccines are effective against severe illness and hospitalization. Isn't that right, Dr. Morris?
So, I think, yeah, exactly. Or another way of saying it is just the risk of getting the vaccine is extremely low compared to, getting the virus, particularly if you have comorbidities like diabetes and in particular obesity. You could be high risk for, a bad outcome. And fortunately, vaccinated or not, the likelihood of death is still fairly low. And I think a lot of people take comfort in that. But, when it happens to you, it's a problem, right? And it affects, obviously, the patient and their family members, their children. We don't want to see anybody lose their life over this, but those severe illnesses and deaths seem to be, for the most part, preventable.
Making the decision to get vaccinated is often challenging. Pregnancy involves self-regulation and body monitoring. There's often a lot of pressure to ensure optimal fetal development. Vaccines will protect the pregnant person and the developing baby from complications associated with a COVID-19 infection. What are some of the challenges that pregnant people have in making the decision to get vaccinated?
Anytime a woman's pregnant, they want to make sure that anything they're putting in their bodies will not affect or harm their growing fetus. And I think that's certainly an understandable concern that would resonate with any pregnant lady. And I think there's been a lot of misinformation on social media that has perpetuated some myths.
It's good to remember that all vaccines currently approved in Canada had to undergo significant scrutiny before given the green light. Health Canada examines the results from the clinical trials. They even have their own dedicated researchers to verify the data. Growing evidence consistently indicates that mRNA vaccines do not cause pregnancy complications or adversely affect lactation. There's no evidence that vaccines cause fertility issues, and pregnant people experience side effects at the same rate as the general public. There are, however, increased risks to the pregnant individual and the developing baby associated with a COVID-19 infection. Maybe Dr. Morris can speak to the side effects or lack thereof associated with vaccination in pregnant individuals.
Well, the recent data is on, I think, 250,000 women, and it doesn't seem to show any harm in any trimester or with breastfeeding. In fact, they're seeing that some of the antibodies will cross and that it's actually protecting the baby, so there may be some benefit.
Now that we know that pregnant people are especially at risk of the severe effects of SARS-CoV-2 and that vaccines provide great protection against disease, I still have a couple of questions for Dr. Morris. Like, at what stage of pregnancy should pregnant people be vaccinated?
No, I don't really know the answer to that, and I don't know if there's strong data to say for sure you should get it at one time or another, or one trimester versus another. But, like I said, it seems to be getting it in the mid-second trimester beyond 21 weeks seems to be an optimal time. I think any time is good, given that we know it seems to be very safe and effective in all trimesters of pregnancy.
Lastly, Dr. Morris, what if someone is pregnant and has questions about vaccines? Where should they go for information?
So, if you're going to do it online, you want to use reputable sites. Certainly, at ontario.ca with respect to COVID vaccines and pregnancy is good. The CDC guideline site is a good resource. And then obviously just, I know some people have trouble getting into their physicians in a timely fashion because of the pandemic. But if you're pregnant, obviously, then discuss it with your either your midwife, family doctor, or obstetrician. We're happy to have discussions on it at any time.
Vaccination while pregnant is safe and effective. Thank you so much to Dr. Morris. And thank you for watching. Don't forget to follow and like us on all of our socials.